Does this man look like he needs a back or a leg brace? He doesn't, but Medicare just paid $3,000 for 5 braces like these that he doesn't want.
So why should you care? Because you and other taxpayers are paying for it. As CBS 2 investigator Pam Zeckman reports, it's part of a huge scam.
I just did something horrible.
Donald, who asked us not to use his last name, had received a call from someone, supposedly from Medicare.
I rattled off my Social Security number, and then I realized, oops, I shouldn't have done that.
He received follow-up calls telling him he could get free back and leg braces, calls like this one.
You may qualify for a knee or back brace at little to no cost to you.
I said to them, this is a Medicare scam. You guys are criminals. Do not send me anything. And I got very angry with them.
Do you need a brace?
No, I'm fine. I don't need a brace.
In fact, Donald's in very good shape and jogs on a regular basis. And even though he refused shipment of the braces, Medicare still paid more than $3,000 in taxpayer dollars for 5 braces that he didn't need and never received.
Which is shocking to me.
Here's how the scheme works. Once the caller has your Social Security or Medicare number, they get a doctor to sign off on a prescription for a brace, sometimes after a telephone examination. The caller then sends the order for the brace to one of several fulfillment companies located around the country.
We talked to a couple of doctors who signed off on these type of prescriptions. They say they get paid about $30 for each phone consultation, but deny being part of any scam.
The doctors told us they were under the impression the patients had requested the braces.
What is your view of how big a problem this is?
Right now, currently, the medical supplies phone scams are the biggest one in the state and across the country.
Donald reported his case to Travis Trumich at Age Options, a senior citizen advocacy group that helps report Medicare fraud.
It's very sad to see these companies are trying to defraud these innocent people here, and it's a crime. So we need to be on top of it.
Patients aren't the only victims here. It's all of us. A 2012 Inspector General's report revealed that taxpayers overpaid $37 million for back braces alone. It's unknown how much money's been wasted in total on unwanted braces, but a 2016 report shows that Medicare paid out almost $2.5 billion for prosthetics and orthotics, including braces.
No, I'm sorry. I did not order any braces.
Mabel Fowler has been inundated with calls after she was tricked into giving out her Medicare number. Then the boxes started to arrive.
I'm surprised. I don't know. I feel like it's Christmas. Getting a package and open it, and I see all this.
Over the course of 4 weeks, she received 10 braces. Back braces, arm braces, leg braces, braces for every limb.
Did you order any of these things?
No.
Did you use any of these things?
No.
Are you concerned about Medicare paying for these?
Yes.
Medicare has already paid more than $4,000 of taxpayer money for the braces. But it gets worse. We found similar braces online for just over $1,000. That's 73% less.
A waste of taxpayer money?
Yes, yes, yes.
About half that money, $2,200, went to a supply company in New Jersey called Matawan HME Incorporated. They refused our repeated requests to explain Mabel's order.
All this begs the question, why didn't Medicare suspect something was wrong before approving payment for all these braces for just one person in 4 weeks?
Back at Mabel's home, many of the braces don't even fit, and she never received any instruction on how to use them.
It's too complicated. And it's definitely not something that'd be easy for her to do on her own.
Mabel's caretaker can hardly believe what she's seen.
If she needs braces, her doctor would call and order them, and her doctor hasn't said anything to me or to her.
We asked another doctor, an orthopedics expert, about Mabel's case.
For a patient to have prescribed multiple braces and multiple body parts without an adequate physical examination or a traumatic event sounds basically ridiculous to me.
Dr. Bush Joseph has never treated Mabel, but her story is all too familiar to him.
Patients are getting braces that don't really need them, and a third-party provider is collecting on them, and the taxpayers like myself are footing the bill for this.
How does this affect everyone?
Well, down the road, premiums could increase for Medicare.
And fraud like this threatens the very future of the Medicare program. Donald still can't believe he got taken.
I feel violated, is what I feel. That's odd. I would have the same feeling I felt when I was robbed once.
Both Donald and Mabel's cases have been referred to the Inspector General's office and Medicare for investigation. Agency spokeswomen say they cannot confirm or deny whether investigations are underway, but combating health care fraud is a priority. We have numbers you can call to report fraud on our website at cbschicago.com. And Rob and Erica, they should also report it to us.
All right. Thank you, Pam.